Chinese health officials are warning of a surge in respiratory illness across the nation that are primarily affecting children. Officials report seeing more cases of the flu and pneumonia. The World Health Organization says the rise in cases is not caused by a novel virus like the initial COVID-19 outbreak. The WHO and China have not detected any new or unusual pathogens, they say. Keri Althoff joins us now. She's an epidemiology professor at the Johns Hopkins Bloomberg School of Public Health. Thanks for being with us. You know, when people hear this, they will be suspicious of government takes. But if there are surging cases, certainly a cause of concern for people. Why is this happening now? And from your view, why China?
So we have to remember that the COVID-related lockdown in China lasted for a very long time, and it was really lifted in January of 2023. So China is heading into its first winter respiratory season post-COVID. And we have to remember that when people were in lockdown, when people had more restrictions, there was a lot less virus circulating. So particularly among these young children who may have not have been exposed to these viruses in the past, they seem to be becoming ill with a number of respiratory viruses that they haven't been exposed to. And this type of pneumonia that they're talking about is oftentimes a little bit opportunistic. After a viral infection, this type of pneumonia tends to happen. And so I think really what is happening here is the same thing that happened in a lot of different areas across the world, including the United States, with a really hard and intense respiratory season following the lifting of COVID lockdowns.
And you mentioned COVID. Obviously, news like this reminds everyone of what we've all been through with the coronavirus outbreak. But, you know, to help people relax, explain how this is different.
So this is different because many of these respiratory pathogens that these children are becoming infected with, according to what the Chinese government has told the WHO, are different viruses that we know are very common, and we know that they are not novel. There is pathogen surveillance and exploration to make sure that there is nothing new here, but it is causing this wave of illness. And so really, their mitigation efforts are going to be very similar to what we've been talking about for all respiratory infections. Staying home when you're ill, wearing masks, washing hands, those types of risk reduction behaviors are going to be really critical, as well as making sure that their populations, particularly children who may be a little more susceptible because they have not had as much exposure to these respiratory pathogens in the last few years, making sure they're vaccinated and up to date on vaccine is really important.
Yeah, and Keri, I appreciate how you explain why it's happening in China coming out of, you know, such intense lockdowns, but help people understand why then this same respiratory illness or respiratory illnesses in general are spiking here in the U.S. What's happening?
So we are seeing our really a more typical influenza and RSV and now COVID respiratory season. The CDC, tracks this very closely, and we are seeing our epidemic levels are now between that first season when we came out of COVID and the last season before COVID. So we are coming back to what we believe will likely be our new normal for respiratory pathogens. RSV got a head start this fall, came out of the South, has been circulating. Influenza is hot on its tail right now, and we are seeing a lot of COVID circulation. So that is resulting in a lot of respiratory illness. Given the vaccine coverage and the natural infection immunity, our population does have an increased level of immune protection, as we would expect this far into the pandemic. But we still have a lot of people who are at very high risk for severe illness. So those are the people we need to be focused on right now, and ensuring that we as a population are doing all we can to help protect those individuals, including some of our most loved and valued members of our communities and our families, our older adults.
Yeah, so don't be concerned, but be vigilant. Keri Althoff for joining us today. Appreciate it.